Hello and good evening, our fellow viewers. Welcome to yet another episode of Your Health Matters, the Health Booth, coming to you exclusively on Heavenbound Television. Today we have a very special topic that we're going to discuss, and that is the condition of diabetes. My name is John Kimura, and today I am privileged to be joined by a doctor who's going to help us tackle that kind of condition. And I'd like our doctor to say hi to our viewers before we go on.
Hello viewers, once again it's my pleasure to invite you and to welcome you to this show. I know my face is not new to you, and I'm always delighted to have you watching us as we discuss health matters. And as you have already been told, we are going to discuss diabetes today. So move along with us as we discuss this condition, for it has become so common in the society, and the effects that it causes are so rampant, and we need to really tackle it. And I'm hoping that at the end of the show you will be informed of what diabetes is and how to handle it whenever you are diagnosed with it. Welcome viewers. Okay,
I'd like us to start by defining what diabetes is to our viewers.
Viewers, diabetes is a metabolic disorder, and when we say metabolic, it means that it has issues to do with metabolism of some of the nutrients that we consume, and specifically it is a metabolic disorder that affects blood sugars or sugars that come from carbohydrates that we do consume. And therefore, when one has a metabolic disorder where blood sugars are racing high, then we'd say they are affected by this condition called diabetes.
Diabetes.
Yes.
I've heard you mentioning about sugar, and that's why it's called kisukari.
Exactly. That is why in Kiswahili it is called kisukari. And again, we shall be specifically talking about diabetes mellitus. Diabetes mellitus is the one that is referring to sugar issues. Because the word mellitus is an Italic word that refers to honey or sweetened by honey. So when we talk about mellitus, we are specifically talking about blood sugars that are high. There is another type of diabetes that is not affecting sugars, and it is referred to as diabetes insipidus. So today we are only going to talk about diabetes mellitus.
Okay. So have you exhausted on the types, or there are other types of diabetes?
Actually, I was a little bit categorical on this diabetes mellitus because if we are to go to the types of diabetes mellitus now, we find that there are two major categories of diabetes mellitus. And we have those that are chronic in nature, in that they take quite a while once one has been diagnosed with them. And we have that type or that subtype where they are seemingly not so chronic, they are not permanent, they are reversible, they can be dealt with. So under those that are chronic, John, there are those that the one that we say diabetes type 1 and diabetes type 2. But under those that are reversible, we have pre-diabetes and gestational diabetes. So actually there are 4 in number, but in categories we have those that are reversible and those that are chronic. Okay.
What is the cause? What causes all these types of conditions, the diabetes?
Specifically, the cause of diabetes is unknown. But coming to the specific types, like when we say type 1, what could be causing type 1? Type 1 is a type of diabetes whereby the body is not able to produce this hormone we call insulin. Insulin is produced in the pancreas, and insulin is important for the body to metabolize or to be able to use glucose, which is an end product of carbohydrate metabolism. So when the body does not produce insulin at all, one suffers from diabetes type 1. And why would the body not be able to produce insulin? Sometimes it is because of genetical factors. Somebody was born with this condition whereby they are not able to produce insulin. Okay? again, it can happen when one has a problem with the pancreas. Maybe they suffered a condition we call pancreatitis. Pancreatitis is where the pancreas is inflamed. And in the process of its inflammation, the cells that are supposed to be producing insulin are damaged. Okay? This could be because maybe of viral infection. Maybe the pancreas suffered a viral infection that damaged the beta cells that are supposed to be producing insulin. So failure of the pancreas to produce insulin will lead to diabetes type 1. Okay? Type 2. The body produces insulin. Yes? But the cells of the body are resistant to this insulin that is being produced. They are resistant. Okay? They are resistant. Again, because of genetics, perhaps because of the genetical makeup of a person, or perhaps because of obesity. The major cause or the major predisposing factor for one developing diabetes type 2 is obesity, where the insulin that is being produced is not sufficient enough to reach out to all the cells of the body, because the cells are so many because of obesity. You see? So again, the insulin is not sufficient enough to cause the sugar to enter into the cells. And again, John, we need to understand, why does the body need this glucose? Glucose is necessary for cellular activities, for the cells of the body. The body is made up of so millions and billions of cells, and each cell requires glucose for it to carry out its functions. Okay? So if it doesn't get this insulin, it's not that insulin helps in metabolism of glucose. No, it is that the insulin helps the glucose to enter into the cell for the cell to use the glucose. So if there is no insulin, or if the insulin is not properly uptaken by the body cells, like in the case of obesity, then one develops this condition of diabetes type 2.
And that sounds dangerous.
Indeed, it sounds dangerous because...
When you mention about resistance,
okay.
the body resisting
okay.
insulin.
Okay. Ideally, the body is not supposed to resist this insulin. But because of one reason or the other, maybe genetical makeup of a person, okay? Apparently, their cells have some issues where their uptake for insulin are impaired. Okay? Yeah, so, and again, I said, besides the genetics, obesity is a factor, a contributing factor to one getting type 2 of diabetes. Now, we can talk also of this thing we said, gestational diabetes. Just gestational diabetes comes about when one is expectant. When we talk of gestation, we are talking of one who is expectant. Okay? Mama mjamzito. Right. So when this expectant mama, during the period when she is pregnant, we have this thing we call the placenta. The placenta is supposed to produce hormones that are supposed to sustain the pregnancy. Okay? So these hormones somehow cause the resistance of the body cells to insulin. You see? So once this resistance has occurred, the sugar levels in the blood get higher, and therefore one gets gestational diabetes. But the good news about gestational diabetes is that after delivery, this will be sorted out. Okay? It will be sorted out. Again, not every woman who gets pregnant gets gestational diabetes. Okay? Again, genetical predisposition. When one has the history of a family member who has diabetes, they are likely to get gestational diabetes. Not that every expectant mama shall get gestational diabetes. Okay? Okay. That's the case, and those are the causes of diabetes.
The last one, there was another one you mentioned, pre-diabetes.
Okay, I said diabetes, pre-diabetes. Okay, pre-diabetes is a condition whereby the sugars are just high, but not to the threshold, where we can diagnose type 2. You see, the blood sugars are high temporarily, maybe for a reason, maybe because you are ailing, and therefore there is a small issue to do with your insulin production, and therefore the sugars are high. But again, when you recover from that ailment, the sugars will normalize. That is pre-diabetes. But it is an indicator that at one point you can suffer from diabetes. Yes.
So I think with all the description of the types of diabetes, I think it would be important for us now to get to discuss about what are these indications, the signs and the symptoms that one who is diabetic.
Okay.
Yes.
Okay. John, about the signs and symptoms, first of all, I want to tell you a story of a mama whose story I heard,
Okay.
that she was driving just along this thicker superhighway, and suddenly her vision got blurred. She could not see clearly until she caused an accident. And after that accident is when she was taken to hospital. Apparently, when they took her blood sugar test, they found that sugars were so high, higher than they should be. So again, that shows that sometimes we do work with this diabetes without knowing that it is there until we find a reason to be tested for it. That is when it is discovered.
Okay.
So among the things that one can notice for them to say that they are diabetic is increased thirst. One feels unnecessarily thirsty. You see, you take water, but again, after a short while, you are again feeling thirsty. That is an indicator that something is wrong with your sugar. It is an indicator. Okay, frequent passage of urine. Okay, we call it micturition. After every short while, you want to pass urine, because again, when you are feeling this thirst, you are going to quench the thirst by taking water. So that shows that it will eventually be led to pass it out.
Yes.
So frequency of passing urine is an issue. Extremely hungry. One may feel extreme hunger, where they want to eat every now and then, because the body is demanding this sugar. But because this sugar is in the blood, it's not in the cells. The body calls for the sugar. Okay. So one feels like eating. But interestingly, as one eats this food, again they may be losing their weight. Why? Because again the body looks for an alternative for energy. That means it will digest the fat that one has, and therefore one may lose their weight again. They are eating, yes, they are feeling hungry, they are eating, yes, but again they are losing their weight. So I talked again of this blurring of vision. Once one is the sugars are so high, so again one may feel fatigued or tired, excessively tired. And another thing, John, that I have to mention, that if diabetes has affected a man for quite a while, this man may lose the sex drive, the desire to have sex goes down, and again they lose their erectile functioning. Okay, they may lose their ability to sustain an erection, and therefore that is an issue again. In women, again they tend to get sores, like skin sores, boils, so to speak. Their boils are common. Vaginal infections are common, especially in women. So again, when you find a person having subsequent boil attacks, so having boil after another, it is always good for them to be checked if they could be having diabetes. Okay, so once one has gotten to hospital, their urine may be taken for testing again. When this urine is taken, there's something that is called ketone. Ketone is an end product of protein digestion, metabolism or breakdown of protein. So after that breakdown, and now that the body is digesting the protein that one has, again these proteins will be found in urine in form of ketones. So those are some of the symptoms that one can express once they are diabetic. Yeah. Okay.
And maybe are there tests that maybe you can tell us of that one should undergo when they are? Yes,
there are tests that one has to undergo. Majorly, there are about 2 to 3 tests that one can undertake for diagnosis of diabetes. One may undergo a test whereby you get to the hospital and they take a random blood sugar. Actually, the test is majorly to find out the levels of sugar that is in the blood. Okay. Right. So a random one is where you get to a hospital and they are doing this test onto you, and they find that the sugars are higher than they are supposed to be. Okay. Another test could be where you are now told to fast. You fast for a night, and then in the morning you are tested for the levels of blood sugar.
Right.
Again, they'll be found to be high. And another test is whereby one is given a challenge. It's like challenging the body to see how it metabolizes sugar. One is given a sweetened drink, like maybe Sprite.
Okay.
And after a while, we are expecting that this drink should have been metabolized by the body. The sugars in the drink should have been metabolized by the body. So after this short while, you'll be subjected to a test, and they will find that the sugars are high in the blood, and that those are the tests that can be done to diagnose sugar metabolism issues. Okay.
Thank you so much. So that has been some introduction for what we are discussing about this evening, and that is diabetes. When we come back after a short break, we'll be looking at some of the risk factors that are associated with these types, all the types of diabetes. So don't change the channel. I will be back after a very short while. Welcome back, our viewers, to our second part of our discussion this evening. And today we are discussing about diabetes, and we are doing that with the help of our doctor here. Before we took our break, I told you that we're going to start with some of the risk factors that are associated with these types of diabetes. And I would like our doctor to help us and to help the viewer who is watching us into letting them have the knowledge of what are these some of the risk factors that contribute to one having diabetes.
Okay. Viewers, as we said earlier, that the major cause of diabetes mellitus may not be known. However, we have some factors that are linked to one having diabetes mellitus, and these factors are the ones that we are calling risk factors. And these risk factors does not mean that one must have one or two of these risk factors before they develop diabetes, okay? Because along the way, you may suffer what we said, pancreatitis, and get diabetes. So these risk factors are just warning factors, warning signs, warning factors that if you have them, chances of you getting diabetes mellitus are high. Therefore, if you have a family member who is diabetic, and especially the parents, okay, if one or two of both the parents have diabetes, chances are that you are predisposed to having diabetes later on in life, okay? So family issue, diabetes tends to run in families, and therefore if a family member, and especially the parents, has diabetes, chances are high that you can get diabetes. Another thing is the environmental factors. Environmental factors means that one is exposed to some viruses that are damaging to the pancreas cells, the cells that produce insulin. So if one has exposure to viruses that can cause damage to the pancreas, they are likely to get diabetes, okay? Another factor is the presence of immunological diseases. Immunological diseases or autoimmune diseases where the cells of the body turn against themselves, okay? One can get this condition and have the cells turn against the cells of the pancreas, okay? And then this causes a risk factor for one getting diabetic, okay? Another thing is about weight. You remember, viewers, we talked about obesity as being a factor that is quite contributory to one getting diabetic. And this obesity comes about after one has led maybe a sedentary lifestyle. Sedentary lifestyle is a lifestyle whereby one just sits, okay? Maybe if they are employed, they walk from the house to the car to office, sit in the office, back to the car, back to the house. No other activity, okay? Nothing that makes them sweat, nothing that makes them burn the excess fats that are in the body. And therefore, this sedentary lifestyle leads to weight gain, and this weight gain, as we said earlier, in the causes of diabetes, predisposes one to getting diabetes type 2. Again, rest, it is said that diabetes is more common in Africans as opposed to our brothers who are non-Africans. Again, age is a factor. As one ages, degenerative changes that take place in one's body again may affect the pancreas and its production of insulin, and therefore age up beyond 45 is an issue that can lead to one getting diabetes because of degeneration of the cellular degeneration, okay? Another thing could be because if one had gestational diabetes, the cells of the body, because of the hormones that were produced during pregnancy, have gotten used to resistance against insulin. So if you had gestational diabetes, chances are high that later on these cells of the body have gotten used to this resistance, and therefore eventually one can become diabetic. And again, in subsequent pregnancy, one risks getting again gestational diabetes. So getting gestational diabetes at one point can predispose one to getting either diabetes type 2 or gestational diabetes that is recurrent. So those are some of the risk factors that are there for us, because that can predispose one to getting diabetes.
Okay, thank you so much. So I would like us also to get to know, is diabetes treatable, or it's just manageable? And if so, what are these treatments that we have for diabetes?
Now, diabetes is a condition, and most of these conditions, John, are not treatable. They are controllable.
They are controllable.
Okay? Just like hypertension cannot be treated, but it can be controlled. That's the sad story about the conditions. Okay? So if one has diabetes, it can only be controlled. Treatable diabetes, maybe we could talk of gestational diabetes as if it is well managed and one works on their weight, then they don't risk getting subsequent attacks of diabetes. Okay? So for treatment, for us to control this diabetes, one, it is to do with our diet. Diet, and especially if it is because of diabetes type 2, which is brought about by weight gain, excessive weight. And when we talk about diet, viewers, we do not mean that now you should completely avoid carbohydrates, because we said sugars come from carbohydrates. Don't avoid them totally. It doesn't mean that way. What it means is that the kind of carbohydrates that you are taking should not be those that raise blood sugars suddenly, okay? Like this food that is so refined, like you are taking rice, you see? So you see, rice is easily digestible, and as it digests so fast, it releases the sugars into the blood circulation, and therefore the sugars are high. But if you add something that is the food that is less processed, carbohydrates that are less processed, they release the sugars slowly. And therefore it won't shoot up as it would if you had taken sugars, the food that was easily digestible. Okay, so again, you need to take more fruits and more vegetables, because you need more vitamins, because again you are at a risk of getting infections. As we shall be looking at the complications of diabetes, you find that you are more at risk of getting complications to do with infection. So you need vitamins, and you need them from fruits and vegetables. Okay, you need again proteins, again, because proteins, and these proteins, again, you don't have to take proteins that are, you need to take proteins that are lean. If you are taking meat, take lean meat. That is the one we call the white meat. Okay, the white meat it has good proteins, as opposed to the other red meat that is so commonly available. So again, you need to take whole grains, as I said, because whole grains do digest slowly and give you energy. They release the energy or the carbohydrates slowly into the body. So as I said, again, you need to cut on your fats, cutting on saturated fats, the trans fats, the fats that are gotten from solid fats, fats, the fats that have been added to hydrogen, so that to make them stable at room temperature. They are solid. These fats are the ones that you need to cut on and eat, and or consume fats that are soluble, fats that are less solid. Those the liquid fats that are available again for cooking especially. So you need to avoid the trans fats and saturated fats, so to speak.
Okay.
So again, on this treatment, after you have looked at your diet, you need to do exercises. Do some the sedentary lifestyle that we talked about. Avoid this sedentary lifestyle. Okay. Now, after you have avoided exercising, it should be part of your program for management of diabetes. Okay. After you've done that, there are drugs that are taken. Some drugs are taken orally, but these oral drugs usually are taken for those who are suffering from diabetes type 2 or pre-diabetes. Okay. But if one is suffering from type 1 means that you are totally not producing insulin, and therefore you need replacement of this insulin. Insulin is important. So if you do not get this insulin, and insulin is not taken orally, it is injectable. It's injected.
It's true.
So one has to get injecting themselves. Initially, you'll be introduced by the doctor, who will inject you to control the acute stage, but eventually you'll be told and taught how to inject yourself and the dosages that you need to inject yourself. And also, together with this injecting of insulin, monitoring of one's blood sugar is important. Yeah, you need to monitor the blood sugar. If you do not have the ability to buy your own machine, again, you need to be going to a hospital frequently, so that your sugars are monitored until they are stable. Because after this, they are you have been injecting, you are monitoring until they are stable. Then you can maybe skip some days, you don't go for monitoring, but on occasionally you have to be monitoring your blood, your sugars. Okay? So those are some of the ways of managing diabetes. Again, you need to, there's at one point one may need surgery. Surgery where the pancreas may need to be replaced. Okay, transplant of the pancreas, so that again you can produce enough insulin to sustain you. But you see, now this is a very delicate thing to do, and it means somebody is donating. So who is this that is donating? They should be dead, because they can't donate part of their pancreas. They have to donate the whole of it. You see, so who is this?
Who's doing that?
Who is doing that? Okay. There's another surgery whereby where the sugars are absorbed in the stomach, maybe in the intestines, may be bypassed. Okay. When now you have issues with absorption of the sugars, okay, a surgery is done to bypass, so that when food is digested primarily in the stomach, it bypasses the absorption stage and goes to excretion. It goes to excretion, so that you don't again absorb all the sugars and get the sugars into the circulation. So those are the surgeries that can be done to control diabetes.
I don't know. I've also seen that what you were talking about bypassing is also used by people who want to manage their weight.
Yes, that is the case. Exactly. It can be done also for those people who want to manage their weight. They may not be diabetic, but because everything they consume is being absorbed, so we need to do away with this absorption, or to control the rate of absorption. So these bypasses can be created, whereby now food, just a little bit of it, the necessary part is absorbed, and the rest is excreted.
Okay. Do we have any signs that one may show and are trouble signs, especially people with diabetes?
Yes. One may be having trouble with their diabetic control when the sugars, despite them injecting themselves, the sugars remain high. This is called hyperglycemia. Hyperglycemia, whereby the sugars are uncontrollably high. When you see somebody is telling you that they have gone to the hospital and the sugars were tested and were like 40-something millimoles per liter, it's very high. When a normal person should be having less than 7, you see 7.5. You see, so when you are now at 40, that is uncontrollable. uncontrollably high, you see. So again, this is an issue. You are having issues. Either the dosage of the drugs that you are taking needs to be adjusted, or you are either taking the food that you are not supposed to take, or maybe you are not doing any effort. You're not making any effort towards controlling the sugars. So again, this needs to be put into check. You will be admitted and the sugars be brought down, but we need to find out why are they running so high. Another situation that can indicate that your diabetes is not under control, you are having trouble with it, is when the sugars again run too low. You have eaten, you have taken your medication as prescribed, but again the sugars go again so low, as low as maybe 3.5 and below 3.5. That is too low, and if it's not taken care of, if it is not again stepped up, these sugars, if they remain this low, one will get comatose. And it is hard to revive a person who has gone comatose because of low blood sugar as compared to the one who has with a high blood. It's easier to control a high blood sugar as compared to bringing up a person who has too low blood sugars. So again, when there is a continuous production of ketones in your urine, the ketones that I was talking about, of the signs and symptoms. When the ketones are persistently high in the urine, this is an indication that now your kidneys have been damaged, and therefore they are leaking. Ketones actually, as I said, are proteins, and therefore if these proteins are again in urine, this is an indicator that now the kidneys are becoming damaged, and again, so you need to something needs to be done to control these sugars that are so high. So hyperglycemia is low, hyperglycemia is high, and then these high ketones in the urine are indicators of sugars that one is having trouble controlling these sugars.
Do we have a normal range of
yes, there is a normal range of sugar. Yes, of sugar levels. It's usually from 3.5 to 7.5 is normal. Okay, it is normal. Between that range, 3.5 to 7.5 millimoles per deciliter. But usually you see sugars are not commonly checked, like temperature, or you see, so until one has begun to see they are becoming thirsty, they are passing urine every night, the signs and symptoms, that is when maybe they'll take a check, or even an expectant mother until she goes to the hospital. And usually it is good to confirm her gestation, her sugar levels at the 24th week or up to the 28th week. She should have known the stability of her sugars. Between the 24th and the 28th week, yes, they should have known the stability of their sugars. So again, when they go to the hospital, and that is why I would want to encourage you viewers and those who if you get expectant, you need to be going to the hospital, because these are some of the things that are looked into because of the effect they may cause onto you. Remember, just imagine getting hypoglycemic, low blood sugars, and you are expectant. You see now, that is something that may be difficult to control.
All right. Thank you so much. Thank you. So viewers, we're going to take another very short break, and when we come back, we're going to deal to see how complicated this condition of diabetes can get to, and what are the preventive measures that we can put into place to actually prevent and maybe even manage these conditions. So see you after a moment. Welcome back, our viewers, to this last part, the third part of the show, and where we are discussing about diabetes. And as we continue to discuss this issue. I would like Dr. to help us maybe with some. Are there any tips that maybe someone should have, possess as first aid to somebody who has maybe had a diabetic attack or something?
Okay.
Yeah.
Now, viewers, as we talked about circumstances whereby now one is having trouble with their sugars, they may find themselves that they are either the sugars are too high or too low. And maybe you are around them. Maybe you are a family member, or you are a caregiver, or you are just a friend, and you know that this so-and-so is diabetic, and suddenly they are collapsing, or you are seeing them sweating so much, and suddenly they collapse. You should be wary of the fact that maybe the sugars are high or they are low. Now, for you to distinguish whether the sugars are high or low, be sensitive to the smell around you. If the smell is of that sweet-smelling sugar, the ketones are being emitted through the nose, then you should know that the sugars are high, and therefore this person requires to be taken to hospital. There's little you can do to control high blood sugar when you are with the victim. Yours is to rush them to the hospital. But if the sugars are low, this smell is not there, then you should be able to intervene, perhaps by giving them a sweetener. Again, this a sweetener, it could be you can mix some sugar with water and put into their mouth, and they shall be revived. Or if you have a sweet, but a sweet can choke them, because again they are becoming unconscious. Okay, yes. So you need to be careful. And again, for now, to the diabetics are usually advised to work with something that is sweet all the time. They are advised to work with something that is sweet, either a sweet, so that when they feel that they are getting dizzy and maybe they are losing their energy, they are becoming fatigued suddenly, they should sense that something is wrong with their sugars and take this sweet something. It could be a banana, it could be a sweet, it could be a biscuit that is sweet. Okay, so that their sugars can be revived suddenly before they can now go to hospital. So in the cases of emergency, these diabetics are advised to work with something that will make their sugars come up instantly. Okay? Again, another advice to the diabetics is that they are advised to work with their card, some identity to show that they are diabetic. Okay? Right. Because you can fall where people do not know you. You see? And cases have been reported whereby those who are identified, when somebody suddenly collapses, you who is a bystander can check and see if they have any indicator that maybe they are diabetic. So this could be of help. Right. So if one is diabetic, they are advised, please work with something that shall identify you as a diabetic. In advanced nations or setups, people have the cards and they hang them around their body, somewhere, maybe inside their shirt or somewhere onto their body, so that if you collapse suddenly, people, when they are checking, they have to check for this card. Are you diabetic? They'll be able to assist you if they identify that your problem is not epilepsy, but it is diabetes. Okay? Okay.
Therefore, it will help them take care of you. So how complicated can diabetes get to? Okay.
Diabetes, dear listener, is a very complicated condition, because majorly it is affecting all systems of the body. Okay? All systems of the body. And unfortunately, it can cause an effect onto the major organs of the body. Right. Major organs of the body include the brain, the heart, the kidneys. This can be affected by diabetes. So when you talk of cardiovascular issues because of diabetes, it means that your heart has been damaged by these high levels of glucose, high levels of sugar. The heart has been damaged. Another thing is neuropathy. Neuropathy is whereby your nerves have been affected by high levels of sugar. And you see the nerves, for example, the optic nerve, the nerve that helps us to see. If it has been affected by sugar, definitely you'll have visual issues. You'll have visual challenges. So the neuropathies are bad. They affect the nerves of almost all parts of the body. And it depends on which nerve is affected adversely. And the symptoms will manifest depending on the nerve that is adversely affected. We talked of a kidney. This is called nephropathy. Again, damage to the kidneys can cause leaking of proteins. Ideally, urine should not have proteins. Okay. So if you are losing proteins through urine, it means the kidneys have been damaged to that extent where now they are not able to hold the proteins, because proteins are large in molecules, okay? So these molecules are not supposed to be passing through the urine, through the kidneys and be excreted through the urine. So when the kidneys are damaged, you lose proteins. And you see, proteinuria is an indicator of an adverse damage to the kidneys. Okay? Right. Okay. Another issue could be the feet. The feet again are also affected because these sugars again may accumulate in the blood vessels that supply the feet. Okay? Besides affecting the blood vessels, they affect the nerves that supply the feet. So again, diabetic foot is a common thing, and it has led to so many amputations, because once the feet are damaged and you get any sore onto those feet, the end result in most cases is amputation. So you can see how damaging this high glucose levels can be. Right. Again, there's another issue to do with, I said, if your nerves are damaged, even the hearing nerve, for example, if it is the one that is affected, you'll have issues with your hearing. So you can lose your hearing ability. We talked of eye damage. Now, if one is expectant and they have this gestational diabetes, the effect onto the baby, is that at one point I mentioned fetal macrosomia, where the baby grows so big that again the mother can get difficulties when delivering. Okay? And such babies again, when they are born with these high levels of sugars in their circulation, when they are now born and the source of the sugars was through the placenta, and now they are detached from the placenta, they can again become hypoglycemic. Their sugars will suddenly go low, and again controlling the low sugars in a newborn is an issue. So a difficult delivery, again a difficult management of the newborn, the complications that can face one who's suffering from gestational diabetes. Besides that, if one is diabetic and in gestation, hyperglycemia, these complications have their own effects onto the affected patient. Yes.
Okay. So you talked about some food condition, and I would like you to help our viewer. Maybe somebody is there and maybe they don't know whether there is that aspect of food care when somebody is maybe suffering from diabetes. So I'd like you to help our viewers to get this information about food care.
Food care, dear listener, our viewer, it is important that when you are diabetic, take exceptional care about your feet. Because any injury or an abrasion or trauma to the feet, healing is an issue. When the sugars are high, healing is an issue. Healing of an infection is an issue. So we talked of effect onto the blood vessels and effect onto the nervous system, and therefore one can have issues with their feet if they do not take good care of them, and the end result is amputation. So to avoid this, inspect your feet daily. Okay? Because of loss of senses, because of the effect onto the nerves, your feet may become insensitive. So you need to take care of by inspecting them to be sure that your feet again are not having any abrasions, they have not gotten any injury, and therefore they are safe. You wash your feet daily with warm water, dry your feet clean, oil them by applying a moisturizer onto the feet so that the feet remain always not so dry, because again when they dry up they can crack, and in the process after they have cracked they can again be affected by this crack, allowing in infection, and these infections do not heal and therefore can affect one's feet. So again it is said that antiseptic solutions are not so good to be used onto the feet unless they have been recommended by a doctor, because again use of these antiseptics can corrode the natural nature of the skin of the feet, and therefore avoid antiseptics onto your feet unless they have been advised by your doctor. Okay. Another thing, do not use heat around your feet or cold, because heat can damage the cells that are insensitive, you see. So, and then an ulcer can develop, or as well a frostbite where you are exposed to excessive extreme cold. This frostbite can cause an ulcer, and this ulcer will not heal so well. So avoid walking barefooted. If you are diabetic, avoid walking barefooted. Put on shoes, but these shoes need to be well-fitting, need to be well ventilated. Avoid plastic shoes, avoid open shoes, because if you get injuries when you are putting on open shoes, this healing will be an issue, and the end result will be the ulcer that is not healing well. Okay. Do not sit or don't sit so much. Don't again stand too long. Avoid such like issues. Again, when taking care of your toes, your toenails, do not cut the toenail as we normally cut all round. No, cut just across. Cut across. All right. To avoid the nail growing again into the tissues. Okay. When you cut, until you cut the corners, you cut round, they may grow into the tissues and cause again an ulcer, which will not be easy to heal. Okay. So if you cannot cut yourself the toes because maybe your eyesight is affected, ask somebody to do it for you. Okay. Helps ask somebody to help you. So when it comes to shoes, we have already said that you need to put on shoes that are well fitting, shoes that are well ventilating, shoes that are not open, but again to not walk barefooted. Okay. Socks, put on preferably cotton socks that are not again constricting, because if your blood supply to the feet is impaired, if you add a constriction by putting on tight socks, you subject this blood supply to further complication. Okay. So you find now again you are cutting the supply that was the little supply that was getting to the feet. So don't put on again so tight socks. Again, the socks are good because they cushion you against the injuries that can result from your shoes. So you need to put on cotton socks, and again they should be well fitting, as well as the shoes should be well fitting. And should you feel like it is a little too cold and you are even getting into bed, you can get into bed in socks, so that again the feet don't get too cold, because if they are getting limited supply of blood, then it means nutrients and again oxygen and again immunological factors that run within the blood are limited as they get to the feet, and therefore you are at risk of getting ulcers that do not heal and eventually losing your feet. So foot care is critical. It's very critical, just as well as taking your drugs and also monitoring your sugars. Yes.
Okay. So we've discussed about this disease in terms of the causes, the types, the complications, and all that. But maybe our viewers, I'm sure you'll be asking yourself, are there any things, are there any actions or preventive measure that one should actually have to ensure that at least they have played their part to prevent them from having this diabetes?
Yes, there are measures that one can put into place to prevent diabetes. And as much as we said that it is unavoidable in some circumstances, because there's no way you can choose the family to be born from, you see. So if you are born in a family where diabetes is running, you have little to do to control that. If you are genetically predisposed because of the genes that you are carrying, genes that are that are resistant to insulin, then you can't do anything to control such like an eventuality that you may get diabetic. So if what you can do maybe is what is avoidable, why not avoid? Don't live this sedentary lifestyle, okay? This life where you are all the time just seated and relaxing the body, you will gain weight. Work on your weight. Avoid by all means weight gain and obesity, especially if you are from a family where diabetes has been at one point mentioned in that family. So if you are from that family, avoid excessive weight. which can predispose you to getting diabetic. So exercising is also advisable. Exercising is not harmful. I don't know why we tend to be reluctant to participate in exercising. But exercising is as simple as just walking and sweating, walking just a distance, a reasonable distance, you see, and you will have exercised enough. Taking a bicycle and riding and enjoying this ride, you see, is an exercise on its own until it will help you in controlling weight. Again, swimming is as enjoyable as it is. It is also an exercise that can help one control diabetes. All you need to know is that if you are coming from a family that is predisposed to diabetes, you can do everything to avoid it by doing what we are saying: healthy eating, watching your weight, exercising, and again taking frequent checkups, going to know just your body how it is, because if it is early diagnosed again, you are better placed because management will be instituted and these complications we are talking about can be averted. Yeah.
Thank you so much. Thank you so much. So I believe our viewers, you have been helped to an extent that now you have the knowledge and the understanding on how you can prevent yourself from getting this lifestyle. Is it lifestyle? It's a lifestyle condition.
Partly lifestyle, partly lifestyle, partly genetic, partly lifestyle. Partly lifestyle because weight is a lifestyle issue.
It's a lifestyle issue.
Weight is a lifestyle issue, yeah? Okay, so partly lifestyle, partly genetic. Is non-infectious though. Okay. It's non-infectious, but you can be inherited.
Okay, thank you so much. So you've heard it from the doctor himself. So that marks the end of our discussion today on our topic, diabetes. So I believe that you have been helped, and I believe you take all the precautions that you need to take to take care of yourself and prevent you yourself from this disease together with your loved ones. So thank you so much for staying tuned to this program every Wednesday from 8 to 9. And I believe that as time goes by, we're going to tackle most and majority of the health issues, because that's why this show is, and it is there for your health matters. I have been your host, John Kimura. So until next time, may God bless you. Continue watching the station Heavenbound Television. Continue engaging us on social media platforms, the Facebook, the Twitter at Heavenbound TV, and also use the number that is there for any queries, for any comments that you may have. So God bless you so much, and may you have a lovely night.